I had a lady come in last week and she got her implants done like 12 years ago. And she had gotten the old acrylic style teeth, which we really don't do too much anymore. But like I said, some people are still trying to do this acrylic or nano hybrid or nano ceramic final teeth. And what happens is they wear down over time and they start looking like garbage. And so we had her in, I got x-rays, and I'm like, yeah, I can make you a new set of teeth. But here's the thing. You have infections in your old implants. She had 4 implants on the lower, 4 implants on the top. And out of those 8 implants, 3 were infected. A lot of times, patients don't really know their teeth and implants are failing. It's like kind of like gum disease. It's a quiet sort of process if your implants have infections. Hey guys, Dr. Lampee here. I'm going to talk about teeth in 24, and the topic today is 3 reasons why full mouth implants fail. I have 20 years of experience. I'm an implant specialist, so I've seen it all. The first reason full mouth implants fail is poor planning. When I look at your x-rays, 2D and 3D CAT scan, I look at a lot of things. I look at bone quality, bone quantity. Do you have soft bone? Do you have medium bone? Do you have really dense bone like oak, or is your bone more like balsa wood or sponge? A very, very good implant surgeon is going to know that they need to find the best bone. And also, a standard teeth in 24 is going to have 4 implants. But sometimes when we find patients who are limited in their bone or have soft bone, I personally am going to recommend that patient have at least 6 implants. Poor planning doesn't happen at my practice that it does in a lot of other practices. So I know where the best bone is, where I'm going to find dense bone, and that sometimes we need to add extra implants to make sure that this doesn't fail. The number one reason why implants fail, it's improper initial planning and assessment of the bone topography in your mouth. The second reason full mouth implants fail is inexperienced surgeons, and I alluded to this in the first mistake. Now, there's a lot of guys that want to try to do this work, this very, very complex dental work, because there's guys like me that make it look easy. And that's not arrogance or anything like that. It's just, it's confidence. After you've done this a few thousand times, but there's a lot of guys out there, not a lot of experience, that don't know what they're doing. They know how to do a very, very easy case on maybe like on a fake jaw on a tabletop that they practiced at an implant course that they did for a weekend or 3 or 4 days. And they're like, oh, I'm so excited to do this in the real mouth. They have to know how to put implants in at certain angles. We use different angles for these implants: 0 degrees, 17 degrees, 30 degrees, 45 degrees, implants in all areas of the upper and lower jaws. We'll put implants an experienced surgeon will put implants near the floor of the nose. They'll put in implants near the sinuses at angles. They'll also use the pterygoid plates, which is where the wisdom teeth used to be. There's also the rare occasional case where if we don't have any bone on the top jaw, we've got to put implants in the cheekbones. Those are called zygomatic implants. For experienced implant surgeons, those are the most challenging, the most critical. There's very few guys that know how to do those well. Now, on the lower jaw, we're dealing with nerves down here. If an implant surgeon were to hit your nerve here and here, you're going to be numb for the rest of your life. Imagine that. That would suck. You're going to have a wonky smile. You're going to be drooling. You're going to be dribbling. You're going to be biting your lip. So you're not going to get that here. We know how to avoid those nerves. The third mistake, this big one, is there's a lot of dentists out there trying to use cheap materials and cheap labs and shortcuts. If someone tells you they want to put in final teeth that are made out of nano hybrid or nano ceramic, I want you to run for the hills. Say no, 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 no. Those are basically really, really fancy words that they're saying 3D printed acrylic. 3D printed acrylic is great for a temporary restoration. I actually have 2 3D printers here at Teeth in 24. We use them every day. They're only good for temporaries, guys. I'm just going to rip off the Band-Aid and tell you the truth. No, you're going to be back in 2-3 years and you're going to have to redo it. You're going to have to make new teeth. They're going to charge you for that again and again. You're going to get zirconia teeth from me. We make them on site. They're highly customized. They are extremely precise. Our precision is unparalleled in the industry. If you have long-term nano ceramic, nano hybrid, PMMA, polymethyl methacrylate acrylic teeth, like a lot of guys are trying to offer at a cheaper price point, here's what you're going to notice. They're going to stain over time. They're going to wear over time. And then one day, because they're plastic, that's the honest answer. They are plastic. Plastic is not strong long term. You're going to be eating some delicious piece of bacon. You know, you're going to be eating a nice sandwich, and you're going to hear that crack. And they're going to split in half. Imagine you're on vacation, you're in Greece, you're in Santorini, you're there with your family. It's your wife and you are having a 40th anniversary with all your kids there. You're eating dinner overlooking that beautiful Greek azure sea, and your teeth come loose. And there's nobody to help you in Greece. Heck, even if you're in New York, there's not going to be many people that can help you. So these are the 3 mistakes I don't want to see you make when choosing an implant center, and these are the 3 things why I don't want your implants failing. The one thing I really want to stress is that dental infections are often painless. They are quiet infections. People don't know they have them, whether they're with natural teeth or with implants. That's why it's important to come in once a year, get a cleaning, get an exam. And that's what I tell all my patients who get their teeth in 24 full mouth implants. I want to see you once a year for the rest of your life, because you're investing in this. You're investing a lot in this. And I want you to know that I'm invested in it too. I'm not going anywhere. I mean, you're putting your trust in me, your faith, and I know you've had bad prior experiences. This is a big deal for me. This is personal. This is a long-term relationship. And your teeth are going to last the rest of your life.